Welcome everyone to this event to showcase something that we've been wanting to do for a long time in our community for our homeless population. And now, thanks in all parts to the concept of partnership, we're actually able to pull off. Now I want to introduce some of the individuals who are here. There's some who are going to be speaking, but also just so in case folks have questions after, they want to talk to some different folks from the community. Just want to highlight a few. Of course, we have our county manager, Julie Morges Baca here. Give us a wave, just so they know where to find you. And from UNMH, Dr. Art Kaufman. Doctor? Awesome. And we also have, I think Bill Wagner's here from Centro Savila. Yes, Bill. And also we have many folks from our family and community staff. That's, of course, Carol Pierce, our director, and our deputy director for behavioral health and public health, Gilbert Ramirez. So, you'll have to excuse me, I have a little bit of October cough. But let's see, Presbyterian, also, Valerie Quintana. Thank you so much. And there's some other folks too, and a couple I'm going to be introducing. So Jenny will get you then, as well as some others. So we're here today to once again talk about homelessness. We know this is a challenge that is facing our city that unfortunately is getting more and more challenging. And so we're trying to step up in different ways to deal with that challenge. And it's something that for many of the folks behind me, they've spent their careers working on in one way or another. And as a city, we have now made this also one of the city's priorities. And that's something that we brought in a couple of years ago by establishing various offices and divisions of homelessness and housing to really try and partner and get the most out of our system. But we also need to provide some more services, and we're going to talk about some of those here today. And we know that when you think about homelessness, it's very difficult to bucket or categorize individuals suffering from homelessness, because their stories are all unique. And so we don't want to generalize their unique stories. But we do know that one common theme, whether it's missed paychecks or addiction challenges, behavioral health issues, a lot of them do require some medical attention in one form or another. And that's something that many of the providers here behind me do each and every day. But it's something that we want to do also out at our city's shelter. So I want to remind folks, just as a brief 101, this is an old prison. This has been our city's winter shelter for some time. Our administration decided it was in the city's best interest to keep this open year-round to try and help stem the challenges dealing with homelessness. But obviously, there's a lot of challenges with this. One, it's an old jail. Two, it's very, very far from town. It's about a 45-minute drive. That is an issue not only for our homeless population, it's also an issue for our providers who want to be there and provide those services. And also, you know, there's obvious other constraints like the fact that there's nothing else out here. So if you need anything else, you have to go back into town. But we're trying to fix some of those issues in the interim. So while we look at some larger solutions to that, we've got to provide services out here, and that's what we're celebrating today. Now, no one entity or government can do anything with respect to homelessness alone. I want to remind folks this shelter is even operated by one of our contractors, Albuquerque Heading Home. And it's an example of how the city actually, we don't even run this. We contract out for it. And right now there's roughly 300 homeless folks basically living in and out of the shelter year round. And so again, this is already a challenge in what we're dealing with here, in addition to all of the other services and centers that are around the city and around central New Mexico. So because of strong partnership with the city and the county and UNM Health Services and Presbyterian and ABQ, the Health Care Center for the Homeless, and Centro Savila and Workforce Connections all together pulling in the same direction, we are at least able to finally offer services out here. And so for us, bringing everyone together, also the New Mexico Department of Health, by the way, has played a role in this too. We're trying to provide case management, which is funded by Bernalillo County. Workforce Connection is working on workforce training and connection to job opportunities. And this is just one piece of the puzzle that's happening all around this issue. As you know, the city is dedicated to the housing first model fundamentally, and we've continued to increase the number of vouchers that we fund. Right now, we currently fund 750 vouchers with several nonprofit providers. And as folks know, also we're directing the public donations, whether it's through the orange signs or whether it's through our housing fund, to really go to housing vouchers. And so far, we've added $2 million more in vouchers for the public. Now, we're also, of course, trying to continue to raise funding for that. Vouchers are about $30,000 a piece on average. So that's been our ask with respect to funding. We think we can take hundreds of more people off the street with the Housing First model through vouchers. Now, of course, there's also bond funding out there for some sort of homeless facility or facilities centrally located into town. And I just want to remind folks that this ask is for the city to step up, like we actually have never done before, to deal with homelessness. And the language as is designed is sufficiently generic in that we will work with council and all of our providers to figure out exactly what we're going to do with that. But I know this, if we don't step up and help with that bond issue, the homelessness challenge is going to continue to get worse because it is that big of a challenge. And so we're asking people to take the first step, and then we'll work with everyone behind me and in our community and our city council to figure out how best to deploy that funding. Now, lastly, I also want to mention that, homelessness is getting worse around the country. And I say that not to point fingers or to blame anyone else for our challenges, but I do want to highlight that our city in many ways is in a much better place than a lot of cities because of the hard work of everyone behind me today. And that includes, by the way, AFR, who has a huge role in this, which we can talk about if we want to talk with them one-on-one. But for us, we know, unfortunately, it's a national problem, but it's still our responsibility. So what is clear is that no one is stepping up for homelessness nationally, and it's never been a state issue. And so it's left to the city, county, and all of our partners in central New Mexico to deal with a homeless challenge that is truly a regional challenge. We get homelessness and everything else from everywhere between Denver and El Paso and Austin and Phoenix. And it's always been that way. That's not new. That is both the blessing of this great location that we live in, and it's also the burden of responsibility that we bear, whether it's our airports or our hospitals or our education system or our homeless system. And so that's also what, in some small short-term way, this is about today, but also in a much bigger way, that's what that bond issue is all about. So to talk more about this issue, I'm going to ask first our county manager, Julie Morges Baca. Julie, come on up.
Thank you, Mayor. I just want to applaud the city for their efforts, and I thank you, Mayor Keller, for stepping up to this vulnerable population that's been, I don't know that they've been ignored, but maybe just been kind of set to the side a little bit, and we'll deal with it, and we'll deal with it. Well, you know what? He's dealing with it, and his administration is dealing with it. And I also want to say thank you for including us, allowing us to play a small part of what you're doing behind us. So thank you for asking, and of course we're happy to provide the funding for the case management services that we'll probably be talking about, which are great and which has made a really big difference. So while it's those who are experiencing homelessness, or those of us working to find answers and bring those in need in from the cold, homelessness is an issue we all share. So there's no boundaries. It's not just a city or a county issue or a state issue. This is our issue. These are human beings that get up and breathe just like us, but they have different challenges, and we can't ignore them. And we have to, it's our responsibility to take care of them. And I just, like I say, I cannot thank the city enough in letting us play a small part of the amazing work that they do behind us. And I want to urge the voters, get out there and vote for this homeless shelter. Look what we have behind us. It's a little gem behind us, but can you imagine what a diamond, what it would be in our community if the voters said yes and we all supported this very important issue. So I think we all need to get together and vote yes and take care of this vulnerable population. I also want to remind you all that there is an initiative that I'm sure that we're already working with the city on. It's a tiny home village. It's a place that will provide a cost-effective home with on-site amenities to those who qualify under the guidelines program, and that is located in the Southeast Heights area. Commissioner O'Malley, that was her initiative. And honestly, it's caught fire. People are understanding. People in that Southeast Heights community said, yes, we want to do something about it, and we really appreciate it. And again, we just appreciate being a part of all of the amazing things that the city is doing, and we will continue to be a good partner when you build the homeless shelter, the new homeless shelter, and we just can't wait to see what's ahead. So thank you all very much.
Okay, and to talk about some sides of this case management, we're going to hear from a few of our practitioners, longtime practitioners, folks who have been helping this population and dedicating, in many ways, their lives to homelessness in central New Mexico. And so I want to begin with Art Kaufman, Dr. Art Kaufman from UNMH, professor and vice chancellor. Doctor?
Thank you very much, Mayor. You know, we take care of people who are homeless in our hospitals and in our clinics. We run health services out at the Reentry Resource Center, a variety of locations, but it's frustrating because there's always the issue of what causes homelessness and what are the issues we can do beyond patching someone else from a fracture, a cut, a psychiatric emergency. And what we realize is if you look at all of the data, the great majority of what makes our communities under stress and not healthy is social problems. It's not the lack of medical services. So the fact that we are able to come and work with this group that has expertise on whether it's housing or social services or jobs, all of those things are transportation. All of those are far more important than what we do in our traditional healthcare system. So what has actually happened over the past year as we work together is actually a new way of working. It's not just for the homeless. It's a way of saying you have to have one-stop shopping for any community. And what we found is it's not just homeless people who have these kinds of stress. It may be masked in populations that have more money, but it's always there. And so we want to go forward working with our collaborative partners in all of our services, because what we found when we screened 50,000 patients in the UNM system and in the First Choice system, 50% of them had at least one adverse social determinant that was not known, because we don't ask questions of patients who come in and ask about homelessness, transportation, utilities, food, social inclusion. Now we're going to be doing that. It's very much based on what we've learned together at this fantastic facility. Thank you.
And also another champion in our community who's been doing this work centrally located for a long time and continues to expand everything they're doing, the CEO of Albuquerque Healthcare for the Homeless, Jenny Metzler.
Thank you, Mr. Mayor. I think anything that I would have to say about what we do at Albuquerque Healthcare for the Homeless, Dr. Kaufman just summed up beautifully. We have been, I'm Jenny Metzler, CEO of Albuquerque Healthcare for the Homeless, and we have been providing services exclusively to the population without homes in this community as a federally qualified health center for more than 3 decades. And we think we've learned something. We know that homelessness is primarily driven by structural issues, including lack of affordable housing, lack of a decent income, and barriers to access to health care that can really devastate, throw someone into homelessness, and then also perpetuate their homelessness. So that's who we are in a model. We've learned a lot through this healthcare lens, and our vision actually would be to have all of these people and the community and political will that we're seeing today, which unfortunately is only happening 3 decades in, to be able to really sit down together and figure out how we can put an end to homelessness once and for all through healthcare collaboration. One of our strategic priorities is to do more outreach. We already do about 80 hours a week. We have teams out in the field doing street medicine, backpack medicine, integrated primary care, behavioral health, art therapy, social services, benefits enrollment, prevention, harm reduction prevention in teams, on the streets, in shelters. This is a great opportunity. We thought we had it all figured out. We came out here and we found people, about a third of the people our teams are seeing out here, we've never seen before. A third are very well known to us. And another third are people who have disengaged, used to come to our services and somehow, because homelessness is so disenfranchising and isolating, had lost touch with us. So we didn't have it all figured out. And we're re-engaging them, which is a great opportunity. One of our other strategic priorities is to share what we've learned in 30-some years about how you provide care to the population without homes and how you get them off the streets. And you don't ever do that alone. And so we have had the opportunity, working with these partners, to really challenge ourselves through regular meetings and conversations about how we elevate that conversation for real impact in bringing people together. And I so appreciate these trusted partners, because I think that we're all learning something together about how to do this even better so that we can get all of these people off the streets into homes of their own. Thank you.
Okay, and now from Centro Savila, Bill Wagner.
Hi, my name is Bill Wagner, founder and executive director of Centro Savila. We're an outpatient behavioral health program. We have offices in the South Valley International District, and I've been working as a therapist for decades in New Mexico, and I've actually had the experience here of meeting people that I've served in the past in community living out here now. So I know that it can happen to anyone, that people fall on hard times, and a lot of those hard times that they fall on are invisible to the human eye. So it takes really listening to people to hear their stories. A traumatic brain injury is not something that you may see when you encounter somebody, but you'll notice changes in behaviors. A substance use disorder is something that you may not see when you first meet somebody, but then you'll see that it changes people's behaviors. You'll see that serious mental illness also changes people's behaviors, and it changes their opportunities in life. Those things can happen to any one of us, and we need to recognize that when people are experiencing those, they need our assistance, and there are systems set up, but they're very fragmented and not connected. It's been an honor to be part of a opportunity to work together with all the great partners that you've just talked to. And it takes real vision, commitment, and leadership to put something like this together. And I'm talking about people, the mayor and the City of Albuquerque, Bernalillo County, UNM Hospital, coming out to say, we don't have to wait till they come to us or the problems come to us. We need to address these problems, and we have to think about long-term solutions. All of the community partners that have been working in this for a long time, like you heard from Jenny Metzler, have been waiting for this kind of an opportunity for all these players that can really make a difference in our community to come together, and now it's happening. And it takes a community. So when new opportunities exist to build a shelter, to create new opportunities for people that are struggling with the kind of things that we see out here in town, so that when we're coming out here in the evening, at 5 o'clock, 6 o'clock at night, providing clinic services to people, we actually have difficulty connecting them with services back in town. So if it's the evening hours, everywhere else in town is closed. We have to wait till the next day. We have to wait till they get back into town. There's transportation difficulties. There's all sorts of logistical problems. When you have a setup like this one, this is a great step, a first step, but we need something in town that is actually going to work during working hours so that people really get connected with the services that they need. So, coming together with not just clinical services that treat the individual, but case management services and full support services that address the social determinants of health that Dr. Kaufman talked about. Things like, having access to work, having access to, a safe place to live, having access to food. Those are difficulties that many of the residents here face. And by the way, it's been very surprising to me as somebody who's relatively new in working actually in a shelter, that many of the people that are living here have day jobs. They're working in the community. They're contributing to our society. There are families living out here. There are children living out here. So we need to do better as a community, and it takes a collective will to do that. So I'm really proud to be part of that. What Centro Savila is doing is providing peer case managers, so people who have the lived experience of many of the residents here, and can show through their skill set how to navigate some of our very complex systems, not by just giving them a brochure, but actually accompanying them in the community to get their basic needs met, by modeling for them the kind of experience and behaviors that it takes to actually succeed, and by inspiring them with hope. And we know that this is as effective as a professional like myself with years of experience in therapy in helping people to function better in society. So we're really proud to be able to work hand in hand addressing all of these very complex issues, and appreciate the vision of our leaders and our community that it takes something like this to really address the problem and address the root causes of homelessness. Thank you.
Okay, so before we wrap up, let me just say that I know a lot of people, every day people ask me, what are your priorities? And I got to tell you, from day one, even on the campaign trail, my priorities are the biggest needs for the city. And that has, unfortunately, not changed. It is still crime, it is still addiction, and it's homelessness. And so that's why we're going to continue to step up to meet these challenges head on. And we know we can't do it alone. It's truly going to take all of us working as one Albuquerque to deal with these challenges together. So we want to give you a tour of an example of that. So I think what we're going to do is we're going to break and we're going to invite, it's actually rare you get to go inside this facility for privacy reasons, but we want to show you some of the new facilities inside that we've built out. If they're new, especially, or if there's an issue like they're, something we have to deal with, whether it might be a level of intoxication or it's a health issue, they wait here and then they're sort of processed and filtered in. This happens every day, every morning and every night. And so, go ahead, David.
All right, so you heard the mayor mention we're averaging around 300 individuals staying per night, per evening. That varies from men, women, families, and children, upwards of close to like 40 children attached to about 20 families. Where you are entering right now is where the men would come in. Safety is one of the utmost important things for us here, and so women and children enter through another area, and men would come in through here. Now, whether you're an existing resident who's here, you would be issued a bed cot number, and you would come in, check in, and you'd be allowed to go to your cot. If you're new, you would sit, get intaked, and they would kind of get you orientated and then issue you a cot number. Two new things here, which is our medical clinic and our social service area. This allows for us to be able to bring partners in the community and give them a space to be able to support individuals, do their work out here where we have a captive audience, and it also allows the doctors and all the staff to come out here and triage patients and see them. You'll also get a little glimpse as to our medical supply area. We've been able to partner with AFR, and they've been very helpful in helping us get the list the doctors have identified as urgent and necessary things to have on site. This space here is basically built out a social service area. We have had multiple tours of our site facility, both with interfaith groups and nonprofits alike, and other shelters, to let them know, one, what are we doing? Two, how are we doing it in partnership? And then three, we need everybody's resources here. And so all of our providers have been asked and welcome to come on out, and if they have a service that's unique to a certain population, whether it's families, women, children, men, behavioral health, we will provide a space and place for you to do outreach and or services for individuals. So you'll see we have 3 office spaces areas here. Workforce Connections came out and we talked to them about job development with our families and making sure that we're getting them prepared to enter into the job market and get back into housing, as the mayor mentioned. That is our strategy. It's not to maintain them here at the shelters, to get them back into a home.